This is a 32 years gentleman who presented with soft tissue sarcoma involving the left shoulder and scapular region. He was operated in July 2022 and biopsy was showing hemangiopericytoma. The patient underwent wide local excision with 3-dimensional clearance and the report came out to be dermatofibrosarcoma protuberance. It was infiltrating deep into the skeletal muscles and all the margins were clear. It was positive for Vimentin with 3 to 4 per 10 height power field and Chi67 index was 20%. The patient has now come in the follow-up presented with a small swelling in the scar region. This is the scar of previous surgery and this is the new swelling with which the patient has presented. It is firm with ill-defined margins, mobile, non-tender, with no overlying ulceration. So this is the scar which has healed with secondary intention and it is starry shaped.
What was the last histology? Dermatofibrosarcoma protuberance.
Yes, sir. Dermatofibrosarcoma protuberance.
So they tend to recur very, very frequently. Although we had a clear margin when we did surgery last time.
Yes, sir.
Karan?
Yes, sir.
We know that soft tissue sarcomas tend to recur frequently, and I've given you the reasons for that. What were the reasons I taught you last time?
So it has pseudopods which extend into this adjacent tissue.
Excellent. So we need to take a clear margin with normal tissue to be removed. You've seen one being done. Now here, I see, the patient has come with a doubtful nodule. And don't think it should be deep all the time because it's mostly a cutaneous thing. So we would like to get a imaging done and an FNA from here. Ideally, a image guided core biopsy is the standard of care where this is it. Can you see this?
Yes, sir.
It may be actually a non-specific knotting that you see in the tissues, but there is no neurological deficit, so it doesn't seem to be something which is infiltrated. If you compare the two arms, no wasting, nothing. कंधा ऊपर उठाओ, नीचे करो, ये हाथ ऊपर रखो, नीचे रखो, ये वाला भी करो. So by and large, I won't say that's a perfect neurological examination, but it doesn't seem to have any functional disability. So we can safely go for establishing first of all that it is. When was he operated?
Sir, July 2022.
So it's normal. It's about going to be a year. So it will be a new primary if at all. The recurrence is within 6 months. Synchronous is within 6 months. Metachronous is after 6 months. It will be taken as a new primary. A panel, shared panel.
Sir, and he had not received any radiotherapy also because it was a low-grade tumor.
It's a low-grade tumor with clear margin R0.
Yes.
There was no indication. The margin was at optimum and adequate. In the MDT it was discussed. I think we have presented it sometime in the past also. It was a huge tumor which was removed and now patient is fine. But good that patient is. See, the key is follow-up. If your patient is in regular follow-up, then you would not miss an early recurrence even if it happens, a new primary. We'll work on it.